Now I am delighted to welcome a really good friend that I absolutely admire as well. Susanne Baars is a person that has done so much already for humanity, but she hasn't even started yet. We would love to see also Susanne in the main display because she's looking amazing as always, and so we can and we can see her smile. So Susanne is the senior global thought expert of Siemens Healthineers. But not only that, she's working on healthcare innovation. She has spoken in TED. She has done work in Harvard. She has done work in the World Health Organization. She is just amazing, working in genomics, working in multi-stakeholder collaboration to bring the industry together with others. Thank you so much for bringing her here. Thank you, Susanne, for being here. We're so happy to have you.
Yeah, thank you so much, and thank you, and hi everyone. Good morning, good afternoon, and good evening. I'm so happy that you, Carlos, and your team are uniting us all on this beautiful day. And exactly what the previous speakers also said, it's amazing to see that everyone is also still here, which is no surprise also to me. And also like the moment that we met, especially your vision. And I think there are so many or all people here with a vision. And that's what I also believe is the power of bringing everyone together, because it's really up to us working on all kinds of global problems, realizing that if we continue working on our missions within the next generation, we can have a completely new world. So that is super inspiring. Something about me. So
we're gonna allow you directly to focus, but first of all, please let's thank her, because the role of healthcare is so vital, and having you here means a lot to us. And we just wanted to thank you, and please say thank you to Susanne in the chat as well. And we allow you to continue. Sorry for the interruption.
Yeah, thank you. I've been thinking, so a short presentation today talking about access to healthcare. A few things to share, and what I thought is I would like to share my own story with you, and then end up with a few key messages and learnings for all of us, and what I hope we can all work on. The topic that I all my life work on is improving access to healthcare, and the reason that I'm so passionate about it is because I come from a medical family, where as a little girl, I always listened to the stories to my father about people dying because of a lack of access. And I never understood, being super privileged to be born in this part of the world, in the Netherlands, where they say we have one of the best healthcare systems of the world, that these stories were still the stories I was listening to, and not once a year, but about every night. And that's because my father is a cardiologist specialized in genetics in the end of the chain. So he usually sees the patients who either already lost someone, or the families who are sent to the left and to the right searching for answers who cannot find it. So basically the end station, where you hear all the things that person's families need to go through. So that deeply touched my heart, and I thought, like, how can it be? And I always wondered the why questions. Why is the system like it is? What can we do more to improve access? What is needed? How can we find more cures for people? And first, I wanted to become a doctor myself. Was not selected. So for 3 years, I think now it should have been this way. And I graduated as a biomedical scientist, as a neuroscientist. And I set up my research at the Harvard Stem Cell Institute 2013 to reprogram cells back to pluripotent stem cells, and then be able to work on a cocktail to build microorgans. I thought with this, we're going to solve the organ problem, donor problem in the world, but also be able to help everyone with diseases. This time, driven by the patient stories in the past, as a scientist, I saw in the system how difficult it is to have access to data. I was confronted with the enormous time and investment it takes to go through the administrative hurdles, and then to the silos that we created. And at a certain moment, I start watching to the world, and I thought, how can it be? You know, we humans have made the borders already between the countries, between nations, dividing people from their backgrounds. Of course, having racism, having geopolitics over it. But then we had the technical revolution. So now with technology, we're able to really connect every one of us and connect life-saving information. But the point is, if you're now diagnosed with cancer and you're in one country, in the south or the north, these hospitals can still not communicate with each other. They can still not see, I have a rare cancer case. How can I, with a push on the bottom, see what are other patients with the same? What are the treatments? What worked for them or what did not work? Everyone is starting the search over and over again. And that makes me think, if we talk about the state of the world and the role of technologies, there's a clear gap that we still need to bridge. The bridge between what is there and how it is in reality. And that is also something for us as leaders to really take a close attention to see in the discussions and the work from like, what are those gaps and what can we truly do? And it often requires system redesign, new ways of thinking, new ways of business models, new ways of designing even the systems and the technologies to solve this. Now, for me as a scientist, I thought, you know, we are with all those brilliant people spending our lives, usually six years on one research. The data is not shared. If you want to solve a disease for one patient group, basically you want to know everything in what's there in the world. And with those silos, we just focus on one database or maybe a few if we're lucky. And then we hope to find the answers there. As a scientist, I always said, it's not difficult. What you need to do is you want to find patterns, because if you find a pattern, you can work towards an insight and you can do something with that. So that again illustrates the need in science already to get this information together. So for me as a scientist, I start thinking about that. I learned a lot about technology, and then I just start thinking myself. And I thought, well, if we have created this complex world, this siloed world, this world with all the politics and difficulties, why don't we do it completely differently? Why don't we focus on patients? Those people whose lives are at risk, those people who are suffering, who are actually searching, who are actively reaching out to solutions that could help them. How can we purely focus on them, their needs, and help them navigate to the right place in the system and reinvent the healthcare systems that we have towards this? Reinvent healthcare systems that are not existing yet in 50% of the world population that doesn't have access to healthcare today, and to redesign all the innovations to improve this further. Now, I did a few more things, but I thought where you work on with patients and with changing systems and on global level. So I also wanted to learn about global healthcare systems. I worked at the World Health Organization at the Global Health and Ethics Department for a while, and set up my own research at Peking University in Beijing, China. And in China, I went there because I did the research a little bit different. And that's also the reason why I bring this up. I believe we need to make people part of the solutions. We have been very good in building systems where we, as experts, think we know everything, where we think in systems where we have a kind of hierarchy. But if we talk about global challenges, what if we can really empower billions of people at the same time? What can we do? And then, of course, we empower with technologies, we empower with mindsets, we empower, but thinking in those abundance solutions. If we talk about access to healthcare, it's really about redesigning systems. A few things I did more is I started a patient foundation and sociogenomics to unite patients worldwide together, to match them based on similar cases, to help them. I invite everyone who is here, who is in healthcare, or maybe knows someone with a disease or is searching for answers. Please reach out to us. We will try to help you. We're connecting the dots. We like to work with you. If we talk about the oncology and my role at Siemens Healthineers in fighting cancer, beating cancer, I just want to say we're working on a future of cancer care where it's all about personalization of treatments to what individuals need. It's about AI to make the treatments more precise and to bring it to new and more places in the world, and early detection, so that we're not only working in disease systems, but really go towards a healthy future where we can cure cancer, hopefully, by diagnosing it early. I want to thank everyone who is here, and I can tell a lot more, but for now I will leave it to this, and I'm happy to connect with all of you. Thank you.
Well, Susanne, I cannot think of a more important mission, and it is just remarkable to see all the work that you've been doing. Also, the fact that you're using data to use precision medicine to tackle the issues in the most effective way, but also that you're allowing patients of different diseases to, reach out to you, to reach out to you and to be in a position in which they can understand what's happening to them and what can be done, and it's just something absolutely needed, and I don't think there's anything like that. So not only you're working really hard in the different responsibilities that you have, but you're also creating something absolutely unique, a moonshot that is perfectly possible, that I'm sure that is going to help a lot of people, and you have our entire support, and we will help you along the way. Thank you so much, Susanne.
Thank you.
You're amazing. Thank you.